Good afternoon. My name is Christopher Lacoste. Today we're going to be doing a focused assessment of the head, face, neck, and lymphatic system. And here I have my patient who is an adult over the age of 18, and I will explain the procedure in just a moment. Do I have your consent to perform this exam today?
Sure.
All right, so what we're going to do today is we're going to do an exam of your head and scalp. I'm going to be testing different cranial nerves and looking at your facial features. I'm going to inspect your nose, your ears, your mouth, and your neck. Does that all sound okay?
Sure.
Okay, so first we're going to do hand hygiene. I already did wash my hands, but we're going to pretend I have some hand sanitizer right here. I'm going to pump and get my hands nice and sanitized, and we're going to gather supplies that we will be needing for this exam. In order to do this exam properly, we are going to have to use a stethoscope. I have my gloves here for palpation and physical exam. We would be using a tongue depressor to examine the mouth. I don't have that, so we're just going to have to kind of go through the motions. I also don't have an otoscope for the ears, so we're just going to kind of talk through that as well. And I do have my pen light for the eye assessment. So first and the least invasive, we're going to start with the head. So for this portion of the assessment, I'm just going to give a general inspection of the shape, the size, and the symmetry of the head and scalp. So we can see that our patient here does have a nice symmetrical head. It is in proportion with the rest of his body. Some conditions that we might look for when inspecting the head would be microcephaly or hydrocephaly. Our patient has none of those. Our patient is able to hold his head up on his own independently without any use. There are no extra movements involved as well. There's no twitching, there's no jerking, so everything here is fully within normal limits. So based on the first physical examination, I am going to put on my gloves and we're going to do some palpation here. So the first thing that I'm going to palpate is his skull and his scalp. So I'm going to look for any step-offs, any deformities. I'm going to look for any bruising, any lesions. And while my gloves are on, I'm also going to be inspecting for any signs of infestation, which thankfully our patient has no signs of, which is all well and good and completely within normal limits. The hair is of an appropriate texture. There's no dryness, there's no flakiness. All of that looks completely perfect. So while I have my gloves on, I'm going to continue, if I may, remove your glasses. Thank you very much. He does have facial hair, so that also does fall under the inspection of the hair. So I'm going to just check the consistency of that. Again, looking for any signs of infestation, any lesions that might be hidden underneath the facial hair. This all looks very well and good as well. While my gloves are on, I'm also going to kind of jump ahead and I'm going to do some areas of palpation on the face. So in particular, there's going to be two areas that I'm going to focus on first, and those are going to be the sinuses. So here we're going to look at, oh, I'm standing in the way. All right. So we're going to be looking at the maxillary sinuses. I'm going to be palpating for any signs of hardness, which may indicate infection. I'm going to ask him if he feels any tenderness when I touch here. Is there any tenderness?
No.
Okay, good. I'm also going to check the frontal sinuses up here, still inspecting for the same, any signs of hardness. Is it tender where I'm pushing?
No.
Okay, good. I'm going to continue on. I'm going to check his temporal arteries right here. I'm going to make sure that there is a palpable pulse, of which I feel a +2 on both sides bilaterally. And it is a nice, strong, regular pulse. Very good. I'm going to palpate along here, the jawline, and the temporomandibular joint. And I'm going to ask you to do a couple things right now. Can you go ahead while I'm palpating this and clench your teeth? Very good. You can feel that firm up right there. And go ahead and open your mouth for me if you would. Okay, perfect. Symmetrical. Everything is working like it should. That's excellent. Okay, so at this point, I'm going to take my gloves off and I am going to perform hand hygiene again. We will be palpating the lymphatic system a little bit later, but so far we've covered the head and scalp, and some of the face. Some other features of the face that I'm going to look for is symmetry. I want to make sure, especially looking at the eyebrows, that they are in line. If there is drooping on one side of the face, that could be a concern for conditions such as stroke or Bell's palsy. Our gentleman patient here has none of those. His face is nice and symmetrical. His mouth, can you smile for me? And it is perfectly symmetrical on both sides as well. So we're going to move on to the ear portion of the exam. So for the ears, I would typically have an otoscope, which I don't have, but we're going to pretend. So for an adult male patient, the best method of inspecting the ears is going to be to lift them up and back, just gently, so that you're not pulling on his ears. In this case, the otoscope would go in and point slightly towards the front and towards the top, almost as if I'm looking up into the ear canal. That will kind of straighten out the ear canal and give me a good view of the tympanic membrane. Some things that I'm going to really be looking for in the ear assessment are going to be a buildup of ceramin. I'm going to be looking for any signs of infection or discharge, and also particularly looking at the tympanic membrane to make sure that we're not bulging. It doesn't look like it's dry and cracked or ruptured in any way. So we're going to say that our gentleman patient here is within normal limits on the full ear exam. Are you able to hear this?
Yeah.
Are you able to hear this?
Yeah.
Does that sound the same on both sides?
Yeah.
Okay, great. So we're going to look at the eyes next. We can see that our patient does wear corrective lenses, so we are going to use the lenses for this exam so we don't render him blind. I'm going to test your 6 different ocular movements now. So I'm going to ask first that you look up and over this way without moving your head. Perfect. Look down and this way. Look off to the side. Same thing over here, down here, and down here. And we can see that the eyes move appropriately and are intact. Continuing with the eye exam, I'm going to grab my pen light and I'm going to check that his pupils are equal, that they are reactive to light. Thank you very much. All right, so we're going to start with the right eye. We can see that without the light, his pupils are +5. Reactive down to +3 on the right. Reactive down to +3 on the left. So through the extraocular movements, we've tested cranial nerves 3, 4, and 6. We're going to move on to the mouth. While we're here, we've done the ears, the eyes, and now we'll look at the mouth. We've already tested the symmetry of the mouth. If you wouldn't mind smiling again for me, I'm going to check the condition of the teeth. They're nice and pearly white. There is no buildup. There is no excess plaque. He takes very good care of his teeth. If you wouldn't mind opening your mouth for me and saying ah. Ah. Okay, perfect. So some things that I'm looking for when I'm checking this. First of all, his dentition is white and his gums are nice and pink. So we assess hydration status that way. He's very well hydrated. He has good oral hygiene. His uvula is midline and it's pink as well.
What's a uvula?
The uvula is the flap that's hanging in the back of your throat.
Learned something today.
This is going to get me good grades. So there's no lesions. There's no anything in the mouth that shouldn't be there. We are going to test his oh, my bad, sorry. So resuming the exam, we're going to continue on with the oral assessment. This is the part where I would use my tongue depressor if I had one, and I would test his cranial nerve 9 and 10 to check the presence of a gag reflex, which I'm assuming is present, and we're going to move forward. So I'm going to move on to the neck assessment. So before palpation, I'm going to ask him a series of just easy to do commands. Can you flex your neck by bringing your chin to your chest? Can you extend your neck by looking up at the ceiling? Can you look left and then right. Okay, perfect. So he's got no extra movements, flexion, extension, rotation, all intact of the neck. So I'm out of gloves, but at this point I would do hand hygiene and I would don a new pair of gloves, and I'm gonna do some more palpation, specifically of the lymphatic system. We're gonna test numerous different lymph nodes. We're gonna start with our pre-auricular. So those are gonna be right here in front of our eyes. I'm gonna be checking for, or our ears, sorry. We're gonna be checking for hardness. Is there any pain where I'm palpating?
No.
Okay, good. So no signs of infection. We're gonna go to post-auricular right here behind the ear. Everything feels normal. We're gonna go to occipital right here. Okay, very good. We're gonna continue to work our way down the neck using our fingertips to just palpate lightly without causing any injury or obstruction. I feel no firmness. Is it tender where I'm palpating?
Ow. No.
Don't listen to him. I'm going to come around and I'm going to palpate the submental lymph nodes. Moving on to the submandibular lymph nodes. Those feel normal bilaterally. I'm going to test the superficial cervical. Right here, just off to the side. That feels good. I'm going to have you turn your head to the right if you don't mind, and I'm going to try to palpate the deep cervical. Those feel great. And if you wouldn't mind turning your head to the left. The deep cervical on the right side feels great. Okay, perfect. I'm going to move on and we're going to test the posterior cervical. Excellent. We're going to do the supraclavicular last. And all of that feels good. While I'm palpating this, I'm gonna go jump back and I'm going to palpate his TMJ, which I have done previously, but this time I'm gonna focus specifically on All right, I lied. I completely already did that. I'm just getting like tied up in my head. So with the time remaining, we're going to continue the neck assessment and we're going to check his trachea. We're going to palpate to make sure that it is midline and his suprasternal notch is midline as well. I'm going to assess for the carotid arteries on either side. It is important to note that you do not palpate both carotid arteries at the same time. That could reduce blood flow to the head and result in him passing out, which might be fun, but we're not going to do that right now. So we're going to check here, +2 on the left, +2. Also, I have my stethoscope here, so I'm going to be checking for bruits on either side.
What's a bruit?
Normal heartbeat. And normal heartbeat. So to bring this assessment to its close, I'm going to finish palpating along the neck, paying particular attention to the thyroid. I'm going to make sure that it's symmetrical, that it is not hard. Is there any tenderness where I'm palpating?
No.
Okay, good. So all in all, our gentleman has a completely normal head, face, neck, and thyroid and lymphatic assessment. I would recommend this gentleman keep doing what he's doing. Thank you for watching.